The Neonatal Intensive Care Unit specializes in neonatal care from birth to 18 months. In the NICU, birth can sometimes begin as early as 22 weeks. The care we provide is unique at every different developmental stage. We are the region's only Level 4 referral center, so we see many different diagnoses, including cardiac lesions, gastrointestinal rehab, genetic abnormalities, chronic lung disease, and surgical patients. Our NICU has a fetal health center where infants with prenatally diagnosed anomalies are delivered. Our nurses are part of the center's delivery team. Our NICU also offers extracorporeal membranous oxygenation, or ECMO, the highest form of life support. Some NICU nurses are specially trained to care for patients needing life-saving measures such as ECMO. In addition to the fetal health center and ECMO, we have a small baby unit, or SBU, that supports the needs of our smallest patients, as well as a chronic lung team that serves our older population with lung disease. NICU nurses have unique opportunities to engage with our families. Some of our patients have tracheostomies and are ventilator dependent. We do a lot of one-on-one training with our parents to prepare those families to go home. The NICU is a very large unit with about 350 staff nurses. We use anywhere from 40 to 50 nurses each shift depending on our census. Patient workload varies with the acuity of our patients. The majority of our assignments are 1 to 2. We do have some 1 to 3 patient assignments for babies who are working on feeding and growing. Our critically ill patients are staffed 1-to-1, and in ECMO situations, we have 2 nurses for each patient, 1 from our specialty ECMO team and 1 for the baby. We hire both new graduates and experienced nurses to the NICU and tailor our extensive orientation to the needs of the nurse. As a new graduate, you will start with a cohort of about 15 to 20 other new grads. Orientation is typically about 6 months long and is comprised of neonatal classes and training that is specific to NICU care. We hire to the night shift, but our nurses spend time on both shifts while on orientation. The NICU is organized in pods, so our nurses are in close proximity. Our charge nurses ensure there's a good skill mix on each pod. New nurses are assigned a pod buddy, so you'll always have a resource available. In addition, we have a really great support staff who are always available to lend a helping hand and answer questions. We work 12-hour shifts in the NICU, 7 a.m. to 7 p.m. or 7 p.m. to 7 a.m. We self-schedule, which allows for some flexibility in your schedule. We do have some weekend and holiday requirements that change over time and become less with more seniority. Support is a big theme in our culture. If someone is having a hard day, we help them out. Our nurses are empathetic, understanding, and definitely detail-oriented. Our patients are tiny, our doses are tiny. We are constantly double and triple checking things. A successful NICU nurse is someone who is committed to being a lifelong learner and invested in change, so we can continue to provide our patients with the very best, most evidence-based care. The NICU can be an emotional environment. More often than not, we are sending our patients home, but we do see death and experience sad outcomes on our unit at times. We offer support to our staff to help with loss. We have a Code Lavender team that checks in on our nursing staff and parents. And we have NICU reflections on a regular cadence to process the hard things that we do. We do this work for a reason, and the rewards, like walking a family down to the circle drive to send them home, outweigh the difficulties. The success of seeing patients and families through from admission to discharge only reinforces the importance of our jobs and the impact that we have on so many lives.